Hey, Dr. Lindsey and Wendy here. Why in the world do you have to cut somebody's hair in order to do a hair transplant?
I do have to shave them.
Shave, cut hair, whichever one you want to call it. Why do we have to do it, Wendy?
Well, because you need to be able to see where you're going to put in those holes.
Right. Doctors got to see to make the holes tight enough to give you a result that you want. If everything goes well, what's the second? You got to see to hit the holes.
Well, yeah, definitely. It took me.
That's the answer.
Yes.
And so if there's a whole bunch of hair laying in the way, you can't see those holes.
You can't see the slits. So I guess we will miss that slit and I won't place a hair in it.
And number 3 is if you hit the hole with the hair, and there's a bunch of hair laying there, it's going to stick to our new hair and pull it out.
That is correct.
That's why. Those
and
are the 3
number 4?
reasons. What are the number 4?
Well, you shave it, and then when you make the slits, and it looks really pretty, but then you can see the spaces in between that you can miss and go back and correct.
You might miss a spot.
Right? Yes.
And that's a good example. So today's Monday. On Friday, we did a 26-year-old Indian boy whose parents flew over from Bangalore, and he's got browner skin than I've got, and great hair to work with. And I made the holes. Here's a picture. And in this spot here that I've got outlined, I missed an area of
It was the transition between your singles and your doubles.
And it wasn't a big area, but it was probably 2 millimeters wide by 15 millimeters long.
Mm-hmm.
And only after those holes, after the slits kind of changed color for the next 25 or 30 minutes, and I was already out of the room talking to his parents, you said, you pointed out where I missed it, and that's exactly right.
Yeah.
And if we had a bunch of hair there, nobody would ever know.
Yeah.
You know? And so it's easy enough to just come back and make 15 holes in there and put the hair in there. And then let's look at one of our favorite patients who got done at big clinic chain, and he paid him for 3,000 grafts. And look at this picture. This is his result, and so we shave him down to fix him. And yeah, there's some hair there. What do you think? There's like 400 hairs there, maybe 500
Yeah,
hairs?
there's like 500.
And so what happened, I know what happened. They left the hair long because that fit his budget, downtime.
And it's the downtime. That's a big deal.
And then when we fix them, we look at all these holes. There's 3,000 holes, and here's 3,000 grafts. And this is what it looks like at 10 months. But if you even if you could convince us not to shave those hairs, from week 4 to week 8, they're all going to fall out anyway. You're going to have shock loss. So why not get a good hair transplant? Because you're going to have shock loss and be bald in that area anyway. Right?
Yeah, I didn't think about that.
Yeah. So we get this question all the time. Why do we shave people's heads?
Yes, that's.
Is it because we want to do less business? No, that's because we want to do it right. If we can help you, please give us a call. Thanks.